Hey, Paul, they say time is muscle and time is brain. Why is starting your treatment on scene so important in the patient care scenario?
The short answer, Kevin, is that you want to improve patient outcomes to the greatest degree that you can. And delaying, especially critical treatments, goes against everything we've ever learned in paramedic school about improving patient outcomes. So we routinely see nowadays, as has always been the case, where providers will opt to extricate the patient out to the truck instead of bringing all their equipment into the patient's side and starting care at the patient's side. And in that time period where they're doing the extrication, we routinely see bad things happening to patients. They deteriorate all the time during the extrication, or once they get out to the truck and they start care, they have a harder time getting on top of that patient's condition, and they have to be much more aggressive. So most protocols nowadays require that providers start treatment on scene at the patient's side prior to extrication, except for specific cases like multisystem trauma. And that's what we try to advocate here at GNA.
All right. Well, I was taught to scoop and screw. How is that wrong?
Well, like I said, for some patients it's legitimate, such as multisystem trauma. In some cases, you want to minimize scene times, like strokes and STEMIs, but that doesn't mean scoop and screw. That means get on scene, do the things that you need to from a patient care standpoint, assess them in basic treatments, but don't waste time on scene so that you can get them to the hospital faster. And again, it's because of that deterioration condition situation. We have a case here in Massachusetts that happened quite a few years ago where the patient was in failure. They opted to throw the patient on oxygen and extricate him out, and halfway down a third flight stair carry down, patient coded. They got him to the back of the truck. They then tried to resuscitate him, couldn't get him back. So the accusation is, how come you didn't throw him on CPAP immediately, being that they were in severe distress? And the providers tried to use the argument, well, we treated him, we threw him on oxygen. But oxygen isn't a treatment, right? That alleviates symptoms. It doesn't actually reverse the causes for which you're there. And we know that CPAP works so wonderfully well in most cases that you can turn around even really bad CHF patients or respiratory patients and get great responses. So it's a little bit of a travesty that this patient coded and then they were behind the eight ball and couldn't get the patient back. So don't let that happen to you.
Yeah. So, where does that mindset come from, and how does the GNA way coach those providers away from that scoop and screw mindset?
There's two in my mind, from interviewing thousands of providers over the years and talking to them. It comes from one of two different sources. One is the provider truly believes that rapid extrication and getting the patient to the hospital faster is better for the patient than us sitting on scene and playing with them. And back in the old day, and in a lot of cases that might have been true, but today we have the knowledge, the skills, the equipment, everything necessary to do everything that ER would do in the first 15 to 30 minutes of the patient's arrival, especially the critical care stuff, the critical things that we need to reverse patient conditions. So it's no longer a case of, well, we can't intubate in the field, so we need to get him to the hospital so he can be intubated. We can't give a certain drug because we've got most of the drugs we need to help most conditions. So that's the innocent provider who just genuinely thinks moving fast is better than actually providing treatment. And you have to convince that provider that that's not the case, that they have all the skills, the knowledge, and the tools to help start reversing that patient's condition before it gets worse. You're the person who's going to do that. The other problem is the providers who are just outright lazy, who just don't want to do stuff on scene. They just want to scoop and screw, get them to the hospital. There's less cleanup, less paperwork if I don't do a lot of stuff. And that's a whole different animal. That's a whole different thing to deal with. But those folks also need to be impressed. It needs to be impressed upon them that their job is to treat patients and to treat them aggressively and early.
So if they want more information, Paul, on what we've written about, I believe we have done a podcast on this in the past. Where would they go?
Yeah, we did a full podcast on this. We have articles on our website. They can go to our website, www.gerardassociates.com. And there's all sorts of resources there. Or if they want more information that they can't find on our website, they're welcome to contact us through the website, and we'd be happy to answer any questions they have.
All right, folks, there you have it. Treat on scene, reduce risk. Contact Paul Gerard at gerardassociates.com. Thanks for tuning in.